thank you so much for your contribution to the Ready, Set, Go conference on March 7th. I think that we had a great
Most welcome.
day, great presenters. Hope you had a good time.
Yes, we did. Yes, yes.
Good. And we got a request from some of those that were there to dive a little deeper or ask a couple more questions about the intersectionality of financial distress or financial concern and cancer.
Sure.
And you did a great job of kind of doing the big picture and then bringing it down to cancer. So I'm going to ask you for the big picture again. So when someone is on traditional insurance, like say employer supported insurance, then
Hmm.
you talked about how typically most things have to have approval first and then they can
Right.
oh, can you talk for just a minute about that process?
Sure. So, any patient that's receiving cancer treatment, when it comes to their insurance coverage, the key to alleviating a patient of um, stresses, the stresses associated with the insurance, which is a term called financial toxicity. It is a medical term penned by a research team at Duke University, I believe, in 2009. And it speaks to the burden that patients uh, come under regarding their cancer treatment that is financially related to those services that the patient may not have been aware of when they started the treatment. So typically patients, they start to compromise their care. They start to have, they have to make very challenging decisions based on paying bills or uh, coverage for services that may not have been covered through the insurance or eating uh, versus the services that financial obligations they have for those services. So um, one of the greatest I would say agent to remove a patient from that particular burden would be to have fully optimized insurance. And what that means is
Mhm.
that they have an insurance plan that will cover their services at 100%. Um, Now, for patients who have commercial plans, they typically, regardless if you have an HMO or PPO, you're going to have annual out of pockets that you're responsible for. You'll have certain deductibles for radiology exams, labs, and that sort of those types of services. For those patients, one of the greatest agents to alleviate those that financial burden would be copay assistance.
Mhm.
Typically, if a patient receives a copay assistance award, let's say from Genentech, and they're receiving rituximab, trastuzumab, so on and so forth, Genentech will provide a $25,000 award for their products. And once that patient receives the copay assistance award, then that those funds can go towards those annual out of pockets. And one typically in a commercial insurance, once an annual out of pocket is met, then the patient services get covered at 100%. So now the typical charges for different services for radiology exams and labs will go away because they have met their financial obligation for
Mhm.
the year through the copay assistance funds. For patients who have Medicare insurance, the greatest position that they can find themselves in with Medicare would be to have a Medicare supplement insurance
Mhm.
plan.
Mhm.
The traditional plans are offered through, um, Blue Cross, Mutual of Omaha, United Healthcare. Any patient can call these companies and just get a quote for a Medicare supplement plan, and they would just want to remember to please differentiate between a medical supplement plan versus a Medicare Advantage plan, because Medicare Advantage is totally different from Medicare Supplement. So
Mhm.
they would definitely want to get a quote and enroll in a Medicare Supplement plan.
Mhm.
Medicare Supplement plan, um, uh, in conjunction with a Medicare original traditional Medicare plan, Part A and B, those two plans will guarantee that their services will be covered at 100%, and they will not receive any financial toxicity uh, because they have two insurances that is covering for their services at 100%. Medicare will pay 80% after Medicare has reimbursed the health care system where they're receiving treatment. Then typically that system will forward that the EOB, the remaining balance to the supplement plan. And all the supplement plan is interested in is making sure that Medicare has paid their portion.
Mhm.
So most healthcare systems, they do not bill the two insurance simultaneously. They will bill Medicare, wait for the reimbursement, then send the reimbursement proof to the supplement plan, and the supplement plan will then pay the 20%, and the patient is removed from
Mhm.
that particular any type of financial obligations because the
Okay.
two insurances will cover it.
Okay. And then the other thing that I was just thinking about when you talked about people that are privately insured, and I know it can be costly, but um I I've really seen some good results when people do things like an Affleck plan, or they do something like a supplemental short and or long-term disability plan. And
Yes,
I know that sometimes they cost, but you have a great saying about we pay now for the moment, for the potential moment
yes,
that something might happen.
absolutely.
And yeah, and so by doing that, you've got some extra protection as a
Sure.
person who's privately insured in case something happens.
Yes. And
Yep.
so with
Now,
those types of plans, they do benefit the patient. The only thing I would say about those plans to be cautious about is to make sure that the plan is very specific to what it will cover.
mm-hmm,
Like some insurances will say, well, we'll give you $5,000 for cancer for any patient that may have a cancer diagnosis,
mm-hmm,
but they don't specify the treatment.
mm-hmm,
So they'll say, well, if you or they'll say the treatment, but not the diagnosis. So just because you have the diagnosis, the plan may not cover anything until you
mm-hmm,
start getting the treatment. So
mm-hmm,
insurance companies, there can be very evasive.
mm-hmm, mm-hmm,
They can be very, especially when it's time to pay,
mm-hmm,
and they can be very, they can be very calculated and detailed. So you
mm-hmm.
must always know exactly what the plan will cover when you purchase those types of insurances, and
Yeah,
make sure it's plainly spelled out
yeah.
so that you are not mistaken or come to a conclusion that, oh, I'm about to get 20, 25, 30, 40, $50,000 because I've been going through this and getting this treatment. And then you come to find out, well, um, then they find another exit route. Well, you have
Yeah.
to get the treatment during this time or within this time period or at this place. So
Mm-hmm,
they can be very, very evasive. And
mm-hmm,
so you must really make sure that the plan is greatly that you understand the specifics and
mm-hmm,
details around the policy, I would say, before buying into it.
mm-hmm. And that makes me think about your role. And we might have to do a part two because I was asked to keep these short,
Yeah,
but we
it's
may have to
okay.
do a part two. But
That's
can
okay.
you can you talk just a few minutes about what your role is, and if most healthcare systems have someone in a position like yours?
Sure.
So first,
So, yeah, go
so
ahead.
first, please tell us your job title and kind of what it encompasses, and then is that job title something that other cancer patients should seek out where they receive services? So, for example, you got this disability policy, you can't read it, the terminology, the lingo. But if I had a Cameron Williams, could I bring that to you to try and maybe even help me call my insurance company, or you read it, or you might be familiar with it? So please tell us, your
Sure.
title, what your responsibilities are, and then, do they have do other cancer centers have people like you around?
Sure, doctor. My official title role is financial navigator. And so you may have individuals in different roles at different health systems that may possibly be under a different title but offer similar
Mm,
services. My primary role is to serve to assist our oncology and non-oncology patients with alleviating, again, the financial toxicity arm of their treatment that can potentially arise. And we assist patients first by uh, uh, trying to make sure that their insurance is optimized, meaning that their insurance is going to cover for their services at 100%. We do that through copay assistance. We do that through insurance interventions where we may see a patient say it has Medicare and they don't have a supplement.
mhm,
And so we will screen that patient to see if they may qualify, say, for state Medicaid.
mhm,
State Medicaid could serve as a supplement. Some patients, oftentimes we are told that from patients that they can't afford a supplement.
mhm,
But then I'll ask, well, have you ever gotten a quote for it? And it would not be fair for you to say, and in fairness, I'm speaking of you being fair with yourself.
mhm, mhm,
Be the
mhm,
best you can to
mhm,
yourself. And so I asked them, well, have you ever gotten a quote? Do you know what insurance costs?
mhm,
Because what we find out is that oftentimes a patient will say that they can't afford a supplement insurance,
mhm, mhm,
and then they get an estimate for their treatment, and then they find out it's going to cost thousands of dollars.
mhm, mhm,
And then they make an effort to pay the money back.
mhm,
They
mhm,
may set up a monthly payment
mhm,
arrangement with the
mhm,
hospital.
mhm,
It could
mhm,
be 100, $200+ a month or so. And so I tell them, well, if you're going to pay the hospital $200 a month on a payment arrangement,
mhm,
be better off with the supplement
mhm,
plan for that same amount, or maybe in some cases less,
mhm,
and and you can remove any debt from your treatment because that supplement plan is going to cover the 80% that Medicare doesn't cover. And then two, so I assist patients with insurance interventions. Some patients go to Medicare Advantage plans purely out of affordability.
mhm,
They are not terrible plans, but Medicare, traditional original Medicare with the supplement is the absolute best insurance because
mhm,
between the two, there is no annual out of pocket. There are no doctor's copays. There are no radiology exam lab copays,
mhm,
anything of that nature. No copays for any types of therapies. When you have these types of services, commercial insurances and Medicare Advantage plans, they typically do come with some type of copay for, again, radiology exams, labs,
mhm,
therapy visits,
mhm,
surgical
mhm.
procedures,
Interventions,
uh,
yeah.
emergency room visits, inpatient
Mhm,
visits.
mhm,
They all come with some type of copay for that the patient is responsible for. So um, with the original Medicare and a supplement, all of that goes out the window.
mhm,
So and so I asked the patients, well, I know that your everyone's financial situation is different,
mhm,
and sometimes we have to reevaluate our finances and make sure that we're not shortchanging ourselves with our insurance. I can go on Facebook Marketplace and get a used shovel or a used lawnmower. I don't want any used insurance
yeah,
because
yeah.
this is your life. You only get one. And
Mhm,
so make sure you're doing the best you can for yourself under all circumstances,
Hmm.
especially when it comes to your health.
Yeah, I
So in
agree.
this particular
Oh,
role,
mhm.
not to cut you off,
No, no,
doctor,
go ahead. Go ahead.
in
No,
this
no.
particular role, I've been in it for 8 years
Hmm.
at the hospital here at our health system, and I do not know of any other financial navigators in this area. So I did
Hmm.
seek some out when I started in this role
Hmm. Hmm.
8 years ago. They do have a system set up at our main campus in Hyde Park, but they do not have a person that actually navigates the
Hmm.
patient
Hmm.
through uh, their treatment journey when it comes to their finances. From my understanding, they do not. They do have teams that help with copay assistance. They do have teams that help patients enroll in which for charity and things of that nature. Charity works with a patient, but charity, with all due respect, does not keep lights on, does not pay nurses' salaries, does not pay physician salaries. And so, if a patient is in a better position to receive copay assistance, number two, and number one, optimize insurance, it would benefit the patient as well as the hospital to
Hmm.
have someone that can assist that patient in those roles to help alleviate
Hmm.
uh, their financial toxicity as well as to create revenue for the hospital, because you have to remember when a patient has optimized insurance, now that patient is going to benefit throughout their healthcare journey, even if they stop their cancer
Hmm.
treatment. You
Hmm.
know, that patient, say that Medicare patient that didn't have a supplement, that's been accumulating, say 20% worth of debt for services. If they receive a supplement plan through the assistance of a navigator, now that the hospital is bringing that 20% of revenue in.
Hmm.
But
Hmm.
not only that, every service they have beyond their
Hmm.
treatment,
Hmm.
now they're no longer going to need charity. They're going to be bringing in more revenue to the hospital. So, with just a small little
Hmm.
individual like
That's.
me
Hmm.
in that role,
Hmm.
it can do a wealth of good for
Hmm.
the patient as well as the hospital. And
Hmm.
remember, anytime you have a conversation with a patient about what they don't owe anymore, that's always going to be a benefit for the hospital as well, when it comes to, PRC scores and things of that nature
Hmm.
too,
Hmm.
uh, from a publicity standpoint.
And it sounds like, the conference was all about, educating, empowering, engaging, and really trying to amplify the voice of the patient. And it sounds like this is a space where we should be amplifying and asking where we receive care. Hey, are there financial navigators within the oncology department? Are they? And if not, why? And how do we get them? Because I think that what you've shared is invaluable and it's a win win for everyone, the patient,
Yes,
the system, and for us as citizens overall, because ultimately everybody has to pay when people don't pay for care. And
absolutely.
so it would make a lot of sense for all of us to advocate for that. And in the last 30 seconds that I have with you, can you tell me a website, a resource, a treasure, a pearl that you think that we all should know about? And I know when you did your breakout session, we talked about a few, and I just wanted to give you 30 seconds to highlight one.
Uh, so many. I would say one. Well, from two perspectives. One really good one is the Pan Foundation. The Pan Foundation
I'm
actually
sorry.
on
I'm
their
sorry.
website,
Wait, I'm
Pan
sorry.
PAN
Thank
is
you.
PAN Patient
Uh-huh.
Access Network.
Okay.
Um,
Foundation. Okay.
the Pan website, Pan Foundation, they have on their website a list of copay assistance companies
Okay.
uh, that offer copay assistance for specific um, cancer funds. So you can go on the Pan Foundation website,
Mhm.
and they do actually have a section where you can look up funding at different various locations, various companies that offer copay assistance. And then
Okay.
remember, every pharma company pretty much offers copay assistance. Virtually every pharma company for commercially insured patients.
Okay. Okay. So Pan
So
Foundation is awesome.
Pan
And it sounds
Foundation,
like you wanted to give
yes.
us one more. Sounds like you wanted to give us one
Yeah,
more.
well, I was just going to say, and remember, if you have a commercial insurance plan, unless it's a drug that's older, that's been around a very long time, but most pharma companies do offer copay assistance for patients with commercial insurances, and even if, and also if a patient has an insurance barrier, if there's like between insurances,
Hmm.
their insurance expired for some reason, you can have the ordering physician's office that ordered the drug have that nurse contact that pharma company and request a free drug application so the patient can get approved for free drug as well.
Okay, and we've also seen that with some oncology pharmacists that,
Yes.
if the depending on the type of cancer, if there's a pharmacist on the team, when they run into that barrier, I've seen that pharmacists go advocate with the manufacturer for that
Yep.
service. But there was another website that you had mentioned, and I don't remember the name of it, but it was another one about helping you find financial resources. I have to go back and look at my conference notes. Um, but I'm going to just give a shout out to www.findhelp.org. That's another just general resource for people in general with lots of things, because we know that people often come into the cancer space maybe with heart disease, diabetes, some other condition, and all these things are starting to get mixed together. So if we think of just a good general resource, that Help Find is another good one.